Today I'm going to be asking the question, are drugs like methadone and Suboxone really a better alternative to fight and combat the opioid problem that's in our country today? Our country is facing a huge opioid problem. They're calling it the war on opioids. Many options are available to those that are struggling with addiction. Drugs like methadone and Suboxone were created to help addicts wean off of these highly addictive prescription pain pills. The use of methadone is usually monitored by a doctor, but it's also given to patients without any kind of supervision. The best solution to opioid addiction is complete detox and treatment. That has been the best route and has shown the lowest number of relapse. Whether it's a spiritual solution that one finds, or just building a sense of community and feeling a part of and finding a sense of purpose with like-minded people, it is shown to keep people sober longer than a chemical solution. So first, let's learn what methadone is. Methadone is an opiate. Most rehabs will not accept people who are prescribed Suboxone and or methadone. It is a long-acting synthetic opioid that is most often used in the treatment of helping heroin addicts stop using. While it is used to help treat addiction, it is highly addictive if not taken when prescribed. It is also a pain medicine. It can help fight pain. Methadone differs from Suboxone in that way, as such, that it can treat pain as long as fight addiction. When you decide to use methadone as a way to treat addiction, you can only access it through a certain type of clinic. A doctor will observe you during each dose. During that time, most of the time they'll only take you if you have insurance or if you can pay. They will not take you if you have Medicaid, any type of government insurance. You have to pay for it. Second, let's take a look at what Suboxone is. Suboxone is used solely to treat opioid dependence. In 2013, the net sales of Suboxone were valued at $1.55 billion. That alone is enough to make me wonder if this is just the pharmaceutical company's band-aid for introducing Oxycontin in the 1990s. Many people think that Suboxone is quite the double-edged sword. This drug is literally treating opioid addiction with another opioid. So you're fighting an addiction with another addiction. Doesn't really make sense to me. Suboxone contains two main ingredients, naloxone and another big word that I can't pronounce. Those are just the two main ingredients that make Suboxone work. One basically blocks the opioid receptors in the brain. This is, on the street, it's called Narcan. This is what you give someone when they overdose normally. It reverses all effects of opioids. This is in Suboxone. So basically making it where when too much is consumed, you become very sick, you become very irritable, and it will trigger withdrawal syndromes when too many opiates are consumed while on the Suboxone. The other main ingredient, that job in that ingredient is to deliver a low dose of the actual feel good that you get from the pain medicine to the brain. It provides a way for the person to still get the feeling that they're looking for in just a smaller dose, and they say it's safer than that person using heroin. So do chemical solutions really work to fight addiction? Can you do it without drugs? From personal experience, the answer to this question is yes, you can. I once had a chemical dependence to opioids and got clean without methadone or Suboxone. Fighting one addiction with another is just not the option for me. There are treatment centers all over the country that specialize in detox and getting to the root of addiction. Once the drugs are out of the addict's system, it is much easier to begin working with them to figure out what made them start using in the first place. Most drug addicts have experienced severe psychological trauma in their lifetime and have never been prescribed any sort of antidepressant, anti-anxiety medication as adults. So they literally have chemical imbalance in their brain, and they're self-medicating. Most addicts. A sense of community and a 12-step program is what some people who once were addicted to opioids and are now clean and sober, that's what they've used, and it has worked best for them. Others, Suboxone and methadone. Some use both. This topic is one that definitely needs to be talked about and shed light on. This is a serious problem in our country, and it's not going to go away anytime soon. Especially with COVID right now, everything's so much worse. The overdose rate is higher than it's ever been before. Methadone and Suboxone can work if used properly and have worked for millions of people, but so have 12-step programs. Treating the mental aspect of addiction is just as critical as treating the physical. Without the proper chemical balance in somebody's brain, they can react totally different than the next person to a narcotic drug. If you know someone who needs help, please refer them to a medical professional and remind them they're not alone. Thanks.